With a huge spike of 35,871 fresh COVID-19 cases in the last 24 hours, this is the highest daily rise since December in India. India is now entering officially its second wave of COVID-19. The government yesterday has said that there are a total of 70 districts in 16 states that have seen an increase of more than 150% active cases. I'm going to break down all of these details for you. Prime Minister Modi has advised micro-containment. He's urged states to avoid vaccine wastage, and he has also said that testing needs to be ramped up. But let me first break down these numbers for you, and let's just look at what India's COVID story currently is looking like. This is the spike in COVID-19 cases as we're tracking them in the last 24 hours. As I've been telling you, 35,871 cases have been reported. If you look at the curve, and this is what is extremely worrying, the last time India saw such high number of cases was back in December, which is here. After that, there has been a steady decline in COVID-19 cases, and sometime in this region, you can once again see that the curve is rising. So there is a bell-shaped curve. This curve right here is pointing to once again the rising COVID-19 infection. So this is what the India's COVID curve currently looks like. Let's take a look at the top 5 states at the moment. Maharashtra has recorded 23,179 COVID-19 cases in the last 24 hours. Compare this with Kerala, Punjab, Karnataka, Gujarat. These states are also seeing a rise, but the numbers nowhere close to what Maharashtra is seeing. In terms of the total number of deaths that have been reported, Maharashtra again continues to be the highest, with 84 deaths that have been reported in the state in the last 24 hours. Punjab also reporting a high number of deaths, 35 deaths in Punjab in the last 24 hours, followed by Kerala, Tamil Nadu and Chhattisgarh. But this is the worrying story that we're tracking for you. Remember, COVID-19 was largely seen in the cities, but what's different about the second wave is that the infection seems to have proliferated to tier 2, tier 3 cities, and therefore also has a high chance of proliferating to rural India. As per the Health Ministry, 150% rise is being seen in 70 districts across 16 states, and 100 to 150% rise in 55 districts. Now, this is according to a 7% moving average. As you can see, these districts that are marked in the red are the ones that are in fact reporting more than 150% rise in the last 7 days. What are some of these worrying districts? Well, Ratlam in Madhya Pradesh is reporting a 500% rise in COVID-19 cases. Now let's look at Chhattisgarh. Surajpur, another district, reporting a worrying 425% rise in cases. Nanded in Maharashtra, which is one of the worst affected districts as well in terms of total numbers, is also reporting a 385% rise, followed by Gwalior in Madhya Pradesh once again with 360, and Yamunanagar in Haryana, that's also reporting 300% rise in cases. Now, one of the things that the Prime Minister has talked about is testing, that India needs to ramp up its COVID-19 testing, and RT-PCR tests need to be conducted. At least 70% RT-PCR tests need to be conducted. This is as far as the tests go. The number of daily tests yesterday also crossed the 10 lakh mark. So if you see, as far as the testing is concerned, it continues to remain consistent. There haven't been any drastic dips, any drastic misses as far as the COVID-19 testing is concerned. But what's the percentage of RT-PCR tests? And this is very important. According to the Health Ministry data, well, Rajasthan continues to do the highest number of RT-PCR tests. Rajasthan is doing 97% RT-PCR tests. But let's look at some of the worst affected states. Maharashtra currently at doing 71% RT-PCR tests, which is not bad. Punjab also very high at 89%. But what can some districts like Chhattisgarh, for instance, do to ramp up COVID-19 testing? Only 34% in Chhattisgarh, only 40% in Punjab. So these are the figures as far as RT-PCR tests are concerned. Now, once again, the other aspect of the India's COVID story, the second wave that the Prime Minister highlighted, was vaccine wastage, and this is a very worrying development. Telangana is reporting vaccine wastage of 17.6% at the moment, which is extremely high. The average as far as India is concerned is 6.5%. So 6.5% of vaccines in India are being wasted. What can we do to undo this? How do we make sense of India's second wave of COVID-19? We have a Very special panel joining us on the broadcast today. Dr. Arjun Dang, he is the CEO of Dr. Dang's Labs, joining us from Delhi. We have Dr. Rakesh Mishra, Director of the Center for Cellular and Microbiology, joining us from Hyderabad. We have Dr. Raghuram, P. Raghuram, he's the President of the Association of Surgeons, joining us also from Hyderabad. And Dr. Rahul Pandit, member of the COVID-19 Task Force from Maharashtra. Thank you all very much for sparing your time and being with us on NDTV. Dr. Rahul Pandit, I have to begin by asking you, Maharashtra continues to remain, the biggest worry in terms of the daily rise in cases. Maharashtra is accounting for over 60% of India's cases. What's your assessment? Why is this happening?
Look, I think we've got to basically be understanding there are several factors for this. The first factor, which all know, and that's across the country, is the all-time inappropriate behavior. So that was the first factor to begin with. Along with that, super spreader events like wedding, parties, people going out in groups and coming positive in large numbers within the group itself. Then third thing which happened at the same time was that the economy sort of opened up and the lockdown lifted out completely. The local trains started,
yes.
The Maharashtra Gram Panchayat elections started at the same time, schools, colleges started. And I think that was just what was needed for Corona to put its head up. And that's exactly what happened. And once it started off, it's been basically now 3 to 4 weeks that we have been reinforcing everything, going back to the drawing board and reinforcing everything back. And I think it's going to take another few weeks before we actually see any improvement in the situation.
All right. Well, the situation has only gone from bad to worse, because in 24 hours in Maharashtra, there's been a 30% rise in COVID-19 cases. So it is an extremely worrying story. But Dr. Rakesh Mishra, I want to ask you, the other big question on everyone's mind at the moment is that there are certain districts, and we'll just put out those figures once again, that are reporting 300 to 500% rise in COVID-19 infections in the span of the last 7 days. What explains this sudden spike in COVID-19 cases concentrated in a few areas? Would you go so far as to say that perhaps this can be attributed to a variant strain of the virus?
That may be a possibility, but I don't see any evidence for that yet. I think more number of genome sequencing needs to be done, and this needs data over a period of time, not in one-time sequencing. So once we see over 2-3 weeks, 4-5 rounds of sequencing done with sufficient number, then we can say if there is particular strain which is spreading more than something else. So far, it doesn't look like. It's just that these are 2-tier, 3-tier cities or rural areas which were not affected so much earlier. So that means they don't have prior exposure like big cities. So in a way, that is somewhat comforting that these are not, there are no reinfection cases and these are not exposed. So the virus now is getting chance. And once the infection begins and if a certain number of people get it spreads in like a chain reaction. So if people are not taking COVID appropriate behavior, that's what will happen. I mean, we know it spreads only through person to person. Right. So this means if it has gone there to so many people that these many people had interacted with each other and some of them were infected.
Yes.
They interacted without mask. So I think even variant is a issue that will come up once we identify and there is a very active effort going on in that direction. But the mask and social distancing they are not variant dependent.
Right.
Any variant, good, bad, mask is what we should use because that's what is going to save.
Right. Dr. Arjun Dang, the other, important story that comes up every time India's COVID cases are on the rise is how can we better testing? Because, I mean, at the bottom line of dealing with COVID-19 infections, like the Prime Minister reiterated yesterday, it is to test, track and treat. So testing is where it all begins. There are certain states where the percentage of RT-PCR tests is below 50%, and those are states that are seeing districts with a spike in COVID-19 infections. How can we ramp up testing?
Okay, thanks Rishika for that question. And certainly we need to ramp up the RT-PCR testing. And I'll go back to last year, and I still remember the date was 18th of May last year. And that was the first day that India actually performed, all the labs in India performed 100,000 or 1 lakh RT-PCR tests. And Rishika, this was just 2 months after we started from scratch, when we weren't even able to do about 100 tests a day. So if in 2 months, by the steely resolve and efforts of the healthcare industry, we could go from 0 to 1 lakh in 2 months, I think reaching 70% of the current number of tests being done, that are around 10 lakh a day, shouldn't be an issue at all. So again, coming back to the drawing board, to get a RT-PCR lab up and running, you would probably need 3 things. So the first one would be infrastructure, that is your equipment, your BSL-2 facility. The second would be trained manpower, that is doctors, molecular biologists. And the third one, obviously, is kits and consumables. Now, from the day that we started to where we are right now, there is a huge, robust supply of all these 3 things. With everything being produced in India itself, we are 100% self-reliant. Right. What is most important in these cases is to follow the protocol or the testing strategy that has evolved as the epidemic has moved on.
Yes.
And that is for everyone to be aware and to understand that a rapid antigen test, if negative and a high clinical suspicion, or if the patient is having any kind of ILI symptoms, should immediately go to an RT-PCR test as a reflex test.
Right.
Now, this awareness needs to go out to the physicians, even to the patient, to understand that, okay, I've done a RAT test or a rapid antigen test, but I still have my cough and I should get an RT-PCR test done.
So important to note that all rapid antigen tests, if there's any clinical suspicion, so if you do have symptoms, it has to be followed up with an RT-PCR test, because that really is the first step towards containing the spread of this second wave, and we're still just at the onset. Dr. Raghuram, the other question that a lot of our viewers have had is, will the second wave be as severe as the first wave, given the fact that the medical fraternity is better equipped at dealing with COVID-19 patients now? One so far, thankfully, hasn't seen such high numbers in terms of hospitalizations. What's your assessment in terms of severity?
Good afternoon, Rishika. First of all, I'd like to correct my designation. I have completed my term as the president. I'm now the director at the Kim Collection Center for Breast Diseases in Hyderabad. To answer your question, the second wave hopefully will be better off. At the moment, we have a 96% recovery rate, and the case fatality rate is about 0.6. So it's quite low, and we hope that with the vaccination the process is on, and we hope that the vaccine hesitancy comes down significantly, and more people see we are in a situation where we have vaccine sufficiency, and we are moving to vaccine hesitancy and also vaccine wastage. So I think if we are able to vaccinate people quickly, I think the effects of the pandemic will be significantly less in the second wave.
All right. So you're saying that in the race between the virus and the vaccine, what's different about the second wave is that we do have the vaccine, something that we've all, waited for. What then, Dr. Mishra, in your assessment, are we to make of this vaccine wastage? Has enough not been done to communicate that any risks that are associated with the vaccines are outweighed by the benefits of the vaccine? Why is it that we are seeing this 6.5% on an average all over India, vaccines being wasted?
I mean, that is really most unfortunate thing to hear, that we are wasting vaccine. This is one thing which is a big advantage for this surge that is happening compared to earlier wave that we had. And I think maybe more publicity to the vaccine, more information sharing, and more aggressive advertising and some kind of public movement. But also there has been a negative advertising about the vaccine, and people probably have responded in irresponsible manner in commenting about the vaccine, which is because of emergency approval, certain process were followed.
But let me understand. Yes, so I'm sorry to interrupt you there, but let me understand from Dr. Pandit. Dr. Pandit is a member of the COVID task force at the moment in a state which is the worst hit by coronavirus, and we're seeing cases rising 30% in 24 hours. Would you say that we perhaps, in order to deal with this vaccine wastage, maybe need to liberalize who we are giving the vaccine to, open it up to all individuals above the age of 45? That will minimize infections and reduce wastage.
Absolutely. The population which is getting vaccinated right now, which is the 60 plus and the 45 plus with comorbidities, when we vaccinate them, we are actually going to save lives. Because if you look at the mortality rate in Maharashtra, out of the 50 to 80 mortalities which the Maharashtra is reporting, 80% are from this age group or this high risk category. But the infection is basically also happening in the younger population, which
Yes.
is between 20 and 45 years of age, who are actually venturing out of the house and who are probably bringing back the infection home, or they are also responsible for spreading it. And the COVID appropriate behavior goes hand in hand. So if we actually vaccinate everyone, it will not only break the chain but also save life. So we'll
Right.
have to do dual things.
The
It will have to be hand in hand.
Yes, it has to go hand in hand. The other last question, Dr. Dang, to you. What about fears of reinfection? As somebody who does RT-PCR tests, say, in the National Capital Region, are you seeing cases of reinfection? Is that a very real possibility?
Certainly, Rishika, we have had a few cases of reinfection, and also people with a very high titer of your COVID IgG levels, that is the antibody levels, are getting infected again. So we've also had cases where the antibody level is significantly high, but the person is getting infected again. But the lovely part about the reinfection also is that the symptoms are only very mild versus if you didn't get the vaccine. So certainly I tell everyone who asks me that should we get the vaccine if they are hesitant, I always tell them that getting a vaccine is like driving a bike with a helmet on.
Yes.
So we have all the safety precautions in place. There's a doctor present who is going to take care if there's an adverse reaction, but certainly get a vaccine without thinking twice.
All right. So I think that bike and helmet analogy is something that one should really use, because you can still fall and hurt yourself if you're wearing a helmet, but the chances of you getting hurt badly, of course, are minimized. So do go out and get your vaccine. I'm afraid I'm completely out of time, but we will keep a close watch on the numbers and the testing and all of the micro containment strategies that the Prime Minister has reiterated. Thank you all very much for sparing your time and joining us on this edition of Coronavirus Facts versus Myths.